Thanks everybody for letting me come and speak to you today. I guess what it basically comes down to with my part of the presentations is where do you get it? You have the theory, you have the protocols, you have all of the other important information that you collect throughout the conference, but it all comes down to where do you get it? So because most of these things do have some element of pharmaceutics in them, whether we like that or not, it's a fact of life. And unfortunately for us in Australia, we live in a bit of a desert when it comes to products, latest, greatest products. We've got the population of Greater LA, yet we have a higher demand on drug companies and pharmaceutical companies to spend money to get a drug on the market. A simple thing like a topical local anaesthetic can cost up to $250,000 to get the proper clinical trials done and analytical work done on it. So it'd be like Pfizer announcing a great product over in America. They've just spent $1 million or $2 million releasing in the States, and then LA goes, oh, well, if you want to sell it in Los Angeles, you have to do another $1 million worth of work. So hence we don't get much work. It's got a good side to it that we don't get a lot of unscrupulous things coming over here without being thoroughly tested. But the downside is a lot of our people miss out on a lot of therapies that could be really doing some good work. For instance, we do one particular product for a group called the Stargardt syndrome group. The Stargardt syndrome is a debilitating disease of the eye which blinds young children. Now, there are no availability of therapies for them in Australia. We have to do an arm wrestle on a regular basis with Wyeth in the USA to get some ecothiopate drops, which we have to bring in under a special access scheme. Wyeth is very unhappy about sending them to us, but we tend to find the right staff member from time to time when we get some supplies. We then have to dilute them down in our clean rooms to the right dilutions, and those children then get their monthly supply of drops. This is the problem that comes from a strict system with a very small population. Wyeth is not interested in 1,000 children down in Australia. There's no return on their investment. So compounding is a necessary thing in Australia, probably more so than in the States, because it does give us access to a lot of known regular molecules. What we do here in Australia with the compounders of Australia, we don't create any new molecules. We're not controversial, although you wouldn't know that by reading the press. We deal with known substances that have been proven safe and most times have up to 20 years experience. So getting on with it, anti-aging and skincare, that's the new buzzword even in my industry. And if I can find my little mouse to work here. How about I just use my computer? Okay. When you're doing anti-aging medicine, you need to find a compounder who has expertise in several areas. Generally, the areas are bioidentical hormones, skincare rejuvenation. Discontinued medications are quite often handy if you want to use a product that's available, say, in America but not available in Australia due to low volume. Aesthetic medicine, sterile and IV injectables are handy, especially in anti-aging cosmetic medicine. Dermatological preparations, nutritional compounding is a fast-growing area at the moment. We're seeing a lot of doctors going to the integrative and functional medicine side now are finding that treatment of chronic disease states such as cholesterol, blood pressure, things like this are actually being reversed in a lot of stage, or even played down a little bit by the use of nutritional therapies. So we're seeing a lot of that happening in Australia now, where the doctors have at their fingertips now, which they didn't have 5 years or so ago. They have the ability to actually use nutritional medications and the more natural products to get a result. It works on the theory that when we were 40, we were healthy. Why are we so unhealthy at 45? And these particular doctors, and I'm sure there's a lot of you in the room, look back to the causes of the wheels falling off rather than just putting a Band-Aid on the broken axle, go back and see what's causing the problem. So nutritional compounding is becoming a very important part of what all the compounders do. Another fast-growing area of compounding is detox. We're living in a more and more toxic environment, and Detox these days is becoming a bigger part of the compounder's work because there are no registered products on the market in Australia for heavy metal detox and other therapies that antifungals, antibacterials for chronic low-level infections that besides your antibiotic sledgehammer approach. So we're seeing a lot of increase in detox. We've got a new oral solution now available in Australia which has had a raving success overseas for heavy metals mostly. So it's coming along. We're catching up in those areas. Your compounders can help you with those. Dental preparations, of course, there's a lot of dental medicine going on, anti-aging dental medicine these days. It's a growing field. So things like stop bleed preparations to stop chronic bleeding and preparations for pain stop and balms and bandages to stick on lesions in the mouth, cellulose bandages that can be sprayed on to protect the mouth from sharp surfaces or deliver medication to the oral area are also preparations that are available. The different delivery systems we've got, you can use a troche, which is an unusual term, and it's usually limited to compounders. It's a glycol-based lozenge. It goes into the buccal pouch, and it has a few different advantages. Creams, capsules, gels, the normal sort of run-of-the-mill things. Suppositories, pessaries, injectables, eye drops, and solutions. Buccal troches, the advantage is it avoids the first pass effect, so you can give medications at a lower dose and avoid side effect profiles if they're dose related, especially drugs that cause gastric upset. You can quite often use the buccal troche. Can be flavoured so it doesn't taste too bad. You can avoid the nausea. There's a faster onset of action because it goes straight into the buccal bloodstream, and it allows for the dose to be reduced. Transdermal creams. One slide really doesn't do transdermal creams any justice. Transdermal delivery of medication is such a varied, I could do a 1-hour lecture just on transdermal delivery of systems. The transdermal mode of use is dependent on which drug you're using, whether it's fat-soluble, water-soluble, if you want to put it straight into the bloodstream, if you want to drop it into the adipose tissue, if you want to leave it in the subdermis, or simply just leave it in the stratum corneum. So depending on where you want to deliver the drug to and the physical attributes of the drug you're delivering determines what sort of system you use. You might use a liposomal system. If it's a hairy area of the body, you might use a gel. You might use a solution or a serum if you don't need the moisturising effects. So there's a lot of different ways to, and you can actually have chronic release preparations in a transdermal cream as well. These particular type of creams are quite good when titrating a patient, especially in the hormone area. You can do a metered dose pump, which allows the physician to control the amount of hormone being delivered. So if one pump is 1/4 of a gram and you find that the patient needs more, they can just do 2 pumps of their same medication rather than running off with another prescription and spending another $50 on a new strength. You can use these pumps to titrate the dose. So it's a nice way to get people onto a dosage regime if you're titrating and looking at blood levels. Dermal and labial creams, another cream system. These things can be, these are mostly for local area use, so your labial creams to deliver locally. Hormones generally is the systems there. They're cosmetically appealing generally because, especially the ones for the face, because they're going to be seen and they tend to go into the skin nicely. Post-laser creams, they're only being delivered to the top 2 or 3 millimetres of the skin, so you only need a lightly penetrating creams. You don't want to be driving local anaesthetics deep into the bloodstream. You want to keep them fairly local, but you want them deep enough to take care of the particular procedure that you're doing. So if you're doing a Fraxel laser procedure, you'll need a special Fraxel base. So if you are doing a topical excision, you'll need something that works topically and quickly. So everything that you need for a particular purpose should be discussed with your compounder so that he can get delivered to you exactly the cream base. There's no point putting a white soft paraffin base over the top of a Fraxel procedure. It just won't penetrate quick enough. You have to have a whole lot of different options available to you to get the correct thing for the correct outcome.